On the southernmost tip of UW campus lies a lab on the forefront of autism research. Having been rewarded several grants and staffed by some inspiring minds, Dr. Stone and her team are tackling an issue that affects 1 in 68 of America's children and their families. This is the READi Lab.
READi stands for Research in Early Autism Detection and Intervention, and that's pretty much what we do. We do research, we work with community members to do trainings, and we also do outreach activities to increase awareness of autism and to increase the capacity of professionals in the community to work with and identify these children.
We've spent a lot of time over the last few years doing studies that focus on identifying early behavioral markers and early biological markers. And beyond continuing those types of studies, we realize, okay, we need to span a broad spectrum of activities in the lab, from studies that are looking at 1-month-olds while they're sleeping and looking at associative learning, to actually being out in the community and seeing what's pragmatic and practical for providers to use in screening for autism and intervening for autism.
There's lots of evidence now that early intervention can be really, really effective for children with autism when it's specifically focused to their areas of need. We need to teach young children how to interact, how to have fun with other people and see other people as rewarding, how to have a way to communicate, how to make things understandable and predictable to them, and teaching them to be flexible in the way that they do things and react to the environment.
So one of our studies we call the eye blink conditioning study, and it is looking at a couple potential biological markers for ASD. One of those is the actual eye blink conditioning or associative learning, which for that we have 1-month-olds come in and sleep, and while they're sleeping we do a classical conditioning paradigm where they receive a puff of air to the eye and hear a tone.
The reason we're doing that is because Nathan Fox at Maryland found that they learn while they're sleeping, they learn at 1 month, and that there's great variability in the rate at which they acquire this eye blink response. And more interestingly, that the rate at which they learn it is correlated with their social responsiveness and socially contingent behavior. By identifying differences between groups of children who are at risk and not at risk, there may be some pattern of the children at risk who then will go on to develop autism.
We're interested in these socially contingent behaviors, and we're interested in seeing early markers or early predictors that are so central to autism and are impaired in autism as it develops.
We're trying to really change brain connections, and while the brain is rapidly developing and growing, we're trying to kind of shape it so that children are exposed to the social environment that is the way young children learn.
I think that we hold ourselves to an incredibly high standard in terms of just the integrity of the work that we do. So I think Dr. Stone provides a really good model of that for us in terms of really thinking through the questions that we're asking and why we're asking them and the ways that we go about addressing those questions.
You know, I think it's an exciting place to be. And again, it primarily because of the breadth of our activities.
I think the goal is for us to get better and stronger and to do a better job of reaching families and to have all the coverage we need, because we are really, really busy, and luckily everybody here is very energetic and wonderful.
It's unique to find a lab that is this translational, but then being actually training providers and trying to learn more about what the barriers are that they're facing to implementing some of these validated and evidence-based techniques.
Many research labs stick to research, and we're interested in not just conducting our research, but making sure that the knowledge and findings and procedures that we learn about in research gets out into the community and that we're able to disseminate and convey it.